Hi everyone, I'm Novie Duquilla. I'm from Manila, Philippines. I'm a clinical psychologist, a content creator, and a law student.
Hi everyone, my name is Sharina Manaog, the editor for Medical Channel Asia, and today we will be joined by Ms. Novie Duquilla, clinical psychologist and Juris Doctor. She has over 200,000 followers on TikTok with nearly 1.2 million likes. She finished her master's degree from the University of Santo Tomas and currently taking her Juris Doctor degree. She works with private institutions including rehabilitations that provide mental health services. She's also a content creator and the ambassador for MWell, the fastest growing telemedicine app in the Philippines. Please join me in welcoming Ms. Novie Duquilla.
Hi Sharina, thank you for having me here.
Thank you so much for accepting our invitation, Ms. Novie. It's such a pleasure to be sitting here today and discussing the topic that I think most of us, or if not all, are waiting for, which is around mental health. But before we get into the details, first, I've mentioned how big your TikTok account is out there now, providing so much medical and psychological information, and it's been helping. I first saw you on my For You page when I was scrolling through my FYP. But tell us, with all of the mental health challenges that we are experiencing today, and what you're passionate about, why did you choose TikTok as the platform?
I didn't intentionally choose TikTok. It was actually out of whim that I decided to join TikTok and then create videos related to psychology because this is something that I'm knowledgeable about. And TikTok is a good platform in a way that it's straightforward. It doesn't require so much effort to create contents on TikTok. You video yourself on TikTok, you edit on TikTok, you post on TikTok. Unlike YouTube, I think it's a lot more taxing compared to TikTok.
Right. And Ms. Novie, there are a lot of, conversations, and I think as a community we've progressed somehow in terms of providing a safer community for those who are seeking help or mental health help. But I believe there are still a lot of improvements that needs to be made. We've had conversations about depression and anxiety and all of those very common or mostly talked about conditions. But today we're going to talk about something very specific, and I think this is somehow close to my heart, which is bipolar disorder. So let's start off with the basics. What is bipolar disorder?
Bipolar disorder was used to be categorized as a mood disorder alongside with depressive disorder, but right now it has its own category in the DSM-5. And when you talk about bipolar disorder, it is called bipolar because it has two poles. You have the manic or hypomanic, and then on the different side of the pole, you have the depressive episode. And when you talk about bipolar disorder, there are different kinds of bipolar disorder, and I think people need to know about it because every time I would have a consultation, people would tell me, oh, I was diagnosed with bipolar disorder. And when I would ask them which type, usually they don't know. And the types of bipolar disorders are bipolar 1 disorder, bipolar 2 disorder, and you have the cyclothymic disorder. So these are the main three types of bipolar disorders. When you talk about bipolar 1 disorder, it is mainly manic episode with or without depressive episode. And then you have bipolar 2 disorder. This is both hypomania and major depressive episode. And then you also have the cyclothymia. This is something that is chronic, minimum 2 years. And this is usually hypomania and brief depressive episode.
I see. And in your TikTok contents, Ms. Novie, like I mentioned, I've seen a lot of it, and I've learned a lot from your TikTok contents. And I think it's important how you're using your social media platform to educate the people, and I'm sure that a big part of your purpose is to educate, like what you did right now, telling us that there are actually different types of bipolar disorder. But especially in the Philippines, I think we still have a lot of reservations, not only around bipolar disorder, because I mean, believe it or not, in the Philippines, when someone says they have bipolar disorder, they could be categorized as someone who's crazy, going around, who could switch into different personalities, but that's different all in all. But aside from mentioning all of that, what do you think are the challenges that we're facing or still facing here in the Philippines when it comes to mental health, whether education or awareness?
Number one is the lack of access to free information about mental health disorder. So say for example, in the provinces, they still associate mental health problem with paranormal activities. Second is the lack of access to free psychiatric and psychological services. Psychiatric and psychological services could be very costly for Filipinos. So sometimes there is the desire for consultation, but there is this lack of resources. Third is sociocultural factors. Example is the stigma. Philippines is one of the most religious countries in Asia. And so people tend to associate mental health problem with lack of faith.
I think one of the biggest factors of why a lot of us Filipinos hesitate to go for consultations or for therapies is because of religion or traditions and all of these perceptions that we have towards mental health. What are some of the taboos that you've experienced in mental health, Ms. Novie?
One is that people who seek for consultation are usually labeled as schizophrenic. That's the outright association of people when it comes to consultation, that when you go to therapy, when you seek for psychiatric consultation, you must be someone suffering from schizophrenia.
Right. And I think that's the biggest hindrance for us. It's not really the consultation, the fear of the consultation or the therapy. Rather, it's the fear of what people will tell you when you go for it, right? So help us understand this topic a little better, Ms. Novie. Who is at risk of developing bipolar disorder? Is it someone who suffered from a family trauma, childhood trauma? Does it come with age?
Okay, according to research, people who are diagnosed with bipolar condition, particularly with bipolar 2 disorder, reported having a family member with bipolar condition. When it comes to age, according to research, usually the onset of bipolar condition is during late adolescence, up to early adulthood, so that is 15 to 25 years old. And when it comes to traumatic experiences, according to research, childhood traumatic experience is highly associated with bipolar condition, particularly multiple childhood traumatic experiences. Example, sexual, verbal, and emotional abuse. Another also is biological. Okay, so because of chemical imbalance in the brain, this can also cause the condition, which is bipolar condition. And according to research, usually the norepinephrine, which is a neurotransmitter for your fight and flight response, is high during manic episode, and the dopamine and serotonin, these are neurotransmitters for positive emotions, are usually low during depressive episodes.
I see. So I think that enlightens me a little bit more, because sometimes and I'm sure women who will be watching this video will be able to relate somehow, because I always associate my mood swings with my menstrual cycle.
Yeah.
So actually, this is a possibility that we can also consider, that not everything should be blamed on our periods, that there is something else that could be triggering, or there is another factor to it. All right, so speaking of factors, what are the factors that triggers bipolar disorder? Is there a certain, for example, an accident or an interaction that could trigger bipolar disorder, or for it to come out fully?
Environment is one of the triggers. So example are stressful environments, and significant life change can also trigger bipolar condition. Okay. Second is substance use. According to research, 65% of people who are having substance use disorder tend to develop bipolar condition.
Okay. And so we're now looking at the tendencies or let's get to know more about what are the symptoms, or let's say for lack of better example, what are the early signs that a person can possibly have bipolar disorder?
The early sign, one, would be depression. Okay. So most of the people with bipolar condition first experience depressive episode. That's why it's very important for clinicians to have a working diagnosis and to not immediately jump on having the diagnosis as depressive disorder, because it could be bipolar condition. Usually hypomania and manic episodes manifest later. You also have irritability. This is common among people with bipolar condition, impulsivity or inability to control their decision making. And also you have lack of sleep. Usually they have lack of sleep, especially during manic episodes.
And is bipolar disorder a condition that can be treated? Are there treatments available for it?
Bipolar condition is considered as incurable condition, but what we can help you with is when it comes to the management of the symptoms.
And is this condition something that we could say people will quote unquote suffer from their whole life?
Bipolar condition is considered as a lifelong condition.
Oh, wow, I see. So I think that's one of the heaviest facts from this conversation, because there are a lot of misconceptions
Exactly.
about getting into medication, right? A lot of people, I think, until today believe that medications will cure, which was addressed earlier, which is not, it's incurable. The other one is medications will stop the condition, but that's not the case. It's a condition that an individual would have to carry for the rest of their lives, but could be treated, but could be managed through medications.
Yes, I think that's a very important fact, because sometimes I get comments on my TikTok, people complaining about having consultations and sessions for how many years, but still having the symptoms. It's not only bipolar condition that is incurable, but even other mental health conditions. And as a mental health professionals, it's a no-no for us to give that assurance that you will be cured. But what we can say is that we can help manage with the symptoms.
Okay, now that we're talking about the audiences, whether on this video or on your TikTok account, I'm sure there are a lot of you out there who wants to go for therapy or a consultation, but you're super hesitant because you don't know what to say to the healthcare professional or the mental health professional, right? I mean, if I were to be put in that place as well, I wouldn't know what to say. So, Ms. Novie, what would you advise them to say to the mental health professional when they go for a consultation?
That's a very good question, because even in practice, I experienced that whenever I would ask my clients, so can you tell me the reason for your consultation? They would sometimes say, I actually don't know. And this is my recommendation for people who would go for consultation. Make sure that before you attend your consultation, you list down your concerns, and at the same time, you write down what is your goal for this consultation.
I see. And aside from that, Ms. Novie, there are also people who are hesitating to seek help, but deep inside, they know that they need help. What is the advice you would like to give to those hesitating to seek help or go for therapy?
Number one is identify your source of hesitation. It could be out of stigma or lack of resources. And then try to resolve it. If it's the stigma, then ask people around you who experience having psychotherapy or consultation with mental health professional. Ask them about their experiences, the benefits, so that it can give you the confidence to go through the consultation. And then another is, if there's lack of resources, know that there are actually available and free consultations, especially provided by the government institutions.
Thank you so much, Ms. Novie. And I think if there's anything that I would like to take away from this interview, is that mental health is a topic of now or never. There are a lot of things that needs to be addressed, that needs to be talked about, topics that needs to be discussed. We have to remember that the social media platforms that we have today are actually avenues to educate people with the right information, medical information, but also give inspiration and encouragement to those who have been hiding behind, these curtains, who have been hiding behind all of the symptoms. And social media, like how you used it, will encourage a lot of viewers or a lot of TikTokers even and content creators to use their platforms the best way possible. So thank you so much, Ms. Novie, for your time. Thank you for educating us today.
Thank you for having me. It's a pleasure to be here.
Thank you.